Hello everyone, I am a professional esthetician and cosmetologist. Today's video is most demanding about PRP versus PRF results for skin rejuvenation and hair loss. In recent years, platelet-rich therapies have revolutionized cosmetic dermatology and hair restoration. The two treatments dominate the conversation: PRP, platelet-rich plasma, and its advanced counterpart, PRF, platelet-rich fibrin. Both harness the body's natural healing abilities, but they differ significantly in preparation, efficacy, and longevity. Whether you're battling androgenic alopecia, acne scars, or age-related volume loss, this guide will help you make an informed, science-backed decision. The biological mechanisms behind each treatment, step-by-step procedures, clinical study results, hair growth success rates, skin rejuvenation applications, and much more. So subscribe my channel and hit the bell icon, not to miss latest beauty trends. Section 1. The science of PRP and PRF, how they work at a cellular level. PRP, platelet-rich plasma, the gold standard. PRP has been used since the 1980s in orthopedics and later adapted for aesthetics. Here's how it works. Blood draw: 15 to 30 milliliters of blood is taken, similar to a lab test. Centrifugation: the blood is spun at high speed, 3000 RPM, for 10 to 15 minutes, separating. Red blood cells, discarded. Platelet-poor plasma, mostly water. Platelet-rich plasma, PRP, contains 3-5x more platelets than normal blood. Some clinics add calcium chloride or thrombin to trigger growth factor release. Key growth factors in PRP. PDGF, platelet-derived growth factor, stimulates collagen and blood vessel formation. VEGF, vascular endothelial growth factor, boosts circulation to follicles or skin. TGF-beta, transforming growth factor beta, reduces inflammation and scars. PRF, platelet-rich fibrin, the next generation. PRF emerged in the 2010s as a more advanced, natural alternative. Key differences. No anticoagulants: unlike PRP, PRF uses untreated blood, avoiding artificial additives. Gentle centrifugation, spun at 1500 RPM for 12 to 14 minutes, preserving. Fibrin matrix, a natural scaffold that slowly releases growth factors. More stem cells, critical for tissue regeneration. PRF forms of fibrin clot with. On top layer, platelet-rich, injectable for hair or skin. On middle layer, fibrin, used in dental or surgical healing. On bottom layer, red blood cells, discarded. Why PRF lasts longer? The fibrin matrix acts like a time-release capsule, delivering growth factors over 7 to 10 days, versus PRP's 1 to 2 days. Section 2. PRP versus PRF, Clinical Performance in Hair Growth and Skin Rejuvenation. Hair growth effectiveness. PRP has long been the standard for non-surgical hair restoration, with studies showing a 15 to 25% increase in hair density after 6 months of monthly treatments. However, 2024 to 2025 research reveals PRF's superiority, delivering 25 to 35% density improvements in the same timeframe with fewer sessions. A pivotal Journal of Cosmetic Dermatology, 2024, study found PRF's fibrin matrix extends growth factor activity, leading to 40% faster follicle reactivation in stubborn cases, like postmenopausal hair loss. For early-stage thinning, Norwood scale 1 to 3, PRP remains effective, but those with advanced loss, Norwood scale 3+, see better outcomes with PRF stem cell-rich formula. The International Society of Hair Restoration, ISHRS 2024, notes PRF requires just 3 to 5 sessions every 6 weeks versus PRP's 6 to 8 monthly visits, making it more cost-effective long-term. Skin rejuvenation results. For anti-aging, PRP improves fine lines by 20 to 30% through collagen stimulation, but PRF's fibrin scaffold boosts results to 40 to 50% reduction in deep wrinkles, particularly around the mouth and forehead. Under-eye hollows respond minimally to PRP, while PRF's volumizing effects rival fillers, as seen in celebrity adoptions like Bella Hadid's natural under-eye revival. Acne scar studies show PRP excels for rolling scars, but PRF's precision with ice pick or boxcar scars is unmatched due to its layered growth factor release. Downtime differs significantly. PRP causes 1 to 2 days of redness, while PRF's thicker consistency may lead to 3 to 5 days of swelling, a trade-off for its longer-lasting effects. Notably, a 2025 Aesthetic Surgery Journal report highlighted PRF's 18-month collagen turnover versus PRP's 6 to 12-month window, making it ideal for patients seeking sustained rejuvenation. Section 3, the treatment process, what to expect. PRP treatment process. Initial consultation. A medical professional assesses your hair and skin condition and reviews medical history to rule out contraindications like anemia, blood disorders, or active infections. Blood draw. Approximately 15 to 30 milliliters of blood is collected from your arm, similar to a standard blood test, taking about 5 minutes. Centrifugation. The blood is placed in a centrifuge and spun at 3000 rpm for 10 to 15 minutes to separate components. Red blood cells sink to the bottom, discarded. Platelet-poor plasma, mostly liquid, is removed. Platelet-rich plasma, PRP, is extracted, contains 3-5x more platelets than normal blood. Some clinics add calcium chloride or thrombin to activate growth factors, though this is optional. Preparation for injection. For scalp treatments, a topical numbing cream is applied to minimize discomfort. For facial treatments, PRP may be combined with microneedling or injected directly, e.g., under eyes. Injection process. PRP is injected into target areas, e.g., thinning scalp or wrinkled skin, using fine needles. Pain level is 4/10, comparable to Botox injections. Aftercare. Avoid sun exposure, sweating, and makeup for 24 to 48 hours. Mild redness or swelling may occur for 1 to 2 days. Expected results timeline. Hair growth, visible improvements after 3 to 6 months, requires 6 to 8 sessions. Skin rejuvenation, glow and texture enhancement within 2 to 4 weeks. PRF treatment process, key difference, the method is same with few differences. No additives, blood goes straight into the centrifuge. Longer spin time, 12 to 14 minutes at lower speed. Fibrin extraction, the clinician carefully separates the fibrin clot. Injection, thicker consistency, may require a larger needle, slightly more discomfort. Downtime and side effects. 3 to 5 days of mild swelling or bruising, especially in delicate areas like under eyes. Avoid blood thinners, e.g., aspirin, pretreatment to minimize bruising. Longevity of results. Hair regrowth, fewer sessions needed, 3 to 5 versus PRP 6 to 8, due to sustained growth factor release. Skin tightening, results last 12 to 18 months, versus PRP 6 to 12 months. Ideal candidates. Those with advanced hair loss, Norwood 3 to 6, or deep wrinkles/hollows benefit most. Key takeaways. PRP, faster, cheaper, and better for early-stage concerns. PRF, longer-lasting, more natural, and superior for advanced cases. Section 4. Dermatologist Reviews on PRP versus PRF. For hair growth. According to Dr. Emily Shaw, board-certified dermatologist, PRP works well for early thinning, but PRF delivers longer-lasting results with fewer sessions due to its fibrin matrix. For skin rejuvenation. Dr. Raj Patel, cosmetic dermatology specialist. PRP gives a nice glow, but PRF stem cells make it the gold standard for deep wrinkles and under-eye rejuvenation. Section 5. Cost Analysis and Insurance. The cost of PRP and PRF treatments in 2025 varies significantly based on application and location. PRP hair treatments cost $600 to $1,200 per session, 6 to 8 sessions needed. PRF hair therapy runs $800 to $1,800 per session but only requires 3 to 5 sessions. For facial rejuvenation, PRP costs $700 to $1,500 per session, 3 to 4 annual sessions. PRF offers better long-term value despite higher per session costs. Insurance rarely covers these elective procedures, though exceptions exist for post-surgical healing, and some FSA or HSA plans may offer partial reimbursement. Pricing fluctuates by 20 to 30% in major metropolitan areas, with board-certified specialists commanding higher fees than Medi-Spas, though many clinics now provide payment plans or package deals for multiple sessions. Patients should request before and after portfolios to assess potential results relative to cost. Section 6. Risks and who should avoid it. PRP risks. Headaches from anticoagulants. Temporary shedding, infection if unsterile. PRF risks. Bruising, thicker formula, rare fibrin allergies. Avoid if. Blood disorders, active infections, pregnancy or breastfeeding. Side effects. Redness, 1 to 3 days PRP, 3 to 5 days PRF, possible under-eye lumpiness. Chronic conditions. Diabetes or autoimmune patients, consult doctor first. Aftercare. No sun or sweating 48 hours, gentle skincare 1 week. Warning signs. Fever, pus, severe pain, call doctor. Insurance. Rarely covered, except post-surgery healing. Smokers. Nicotine reduces effectiveness. Section 7. Final verdict. Which should you choose? The bottom line comes down to your specific needs and budget. If you're dealing with early hair thinning and want a more affordable option with quicker procedures, PRP is your best bet, though you'll need 6 to 8 sessions at $600-1, $200 each. For more advanced hair loss or superior skin rejuvenation results that last longer, PRF at $800-1, $800 per session, requiring only 3 to 5 treatments, is worth the extra investment. While PRF generally outperforms PRP, both have their place. PRP works well for maintenance, while PRF delivers more dramatic improvements. Important note: neither treatment is suitable if you have blood disorders or active infections. Always choose a board-certified dermatologist over discount clinics, as proper technique makes all the difference. For those who want the best of both worlds, ask your provider about combining PRP and PRF treatments for potentially enhanced results. Ultimately, your choice should align with your specific hair or skin concerns, timeline, and budget. If you like this video, then like, share and subscribe, not to miss latest updates. Thanks for watching.